Hi, I'm Josh Dufresne. I'm the Chief of Practice Operations for Springfield Medical Care Systems, and I have a special guest, Dr. Scott Durgin, with me here today for the next iteration of the series, of our wellness series. So, Scott, thanks for being here today.
Thanks for having me, Josh.
Really
I'm really
appreciate
excited. Please call me Scott.
Will do, absolutely. So we're here and we're going to be talking about lifestyle medicine, and it's somewhat of a new term. And what is lifestyle medicine?
Yeah, it's new to me too, but if you're going to go to the definition, lifestyle medicine is an evidence-based practice to help individuals and families live healthier, longer, and more functional lives. Practically or simply put, we use lifestyle modifications to try and treat, prevent, and in a lot of cases reverse diseases rather than using medications.
Oh, I see. So this is really kind of cuts back on any kind of prescription drugs, maybe perhaps, that people might be living through that instead.
Yeah, my main focus when I'm working with people, because most of my medical training was to identify disease and treat people with medications, but this practice is mainly focused on trying to keep people off from medications and or reduce their medications and hopefully prevent some of the long-term complications from being on medications or the disease itself, helping prevent some of those complications.
Oh, I see. So you started as not in lifestyle medicine, and this has kind of evolved. It's a little bit about your background. Could you talk to us a little bit about that?
Yeah, I did. This was not a planned spot in life, I guess you could say. I started off as an emergency medicine doc, and I got pretty standard medical training, which was 8+ years of a lot of hard work to identify and treat diseases, and I learned a lot about how to use procedures and medications and the standard medical practice. And it wasn't until I grew up in northern New Hampshire, so I'm from a very small town, and when my wife, who's also a physician, was done her training down around the Boston area, we both wanted to move back to a rural spot, and so we came back to Vermont. And shortly after that, we started having children. And so I've got a daughter and twin boys, and right after the twin boys were born, I left medicine. I retired from emergency medicine. And in having kids, I saw that I wanted to get healthier. And at that time, I was overweight and had high blood pressure and high cholesterol and was taking medications. And I didn't have much of a plan, but other than to go the Bmi in Springfield. I went to try and swim. I couldn't get across the pool, but I joined a master's class because I was over 18. So I slowly learned how to swim, and one thing led to another. I then learned how to run, how to bike, got into short triathlons, and they kept getting longer until I ended up competing and coaching and helping others with Ironman and ultra-distance triathlons. Through that process, I learned an enormous amount about myself and about nutrition. I lost about 40 or 50 pounds. I lost all my medical problems. I felt terrific. And after that, I ended up transitioning into more of a strength training role as it started to make me happy. So I became a bodybuilder, physique competitor, and became a personal trainer, corrective exercise specialist, and was helping people in a gym when my kids were at school use exercise and nutrition to help them feel better. We'd try and treat some of their chronic ailments, shoulders and backs and things like that. And I was loving it until a colleague came from out west and said, "Have you ever heard of lifestyle medicine?" And I had not. And I looked into it and I thought, wow, this is exactly what I believe in now, because I've seen it myself. And so the more I learned about it, I thought it fit what I wanted to try and do. And that's when I approached Springfield Medical Care Systems and said, would you all be interested in this sort of thing? And so far it's been a wonderful experience to watch this grow. It's very new. The American College of Lifestyle Medicine was founded in 2004, and it really didn't start taking off until somewhere in 2013, 2014. Our very first physician boards were just this last fall, October 2017. Wow. So there's only about 200 of us who are physicians worldwide right now that are boarded in lifestyle medicine. So it's a newer, emerging field of medicine, and I hope it grows because it makes me feel wonderful to help people find the same change I did.
That's great. One of the things that, in hearing you speak and kind of speaking about the passion, what really brought you to here, one of the things you said, learn to swim, learn to run, and it just kind of illustrates that a lot of us think we know how to run, perhaps. I'll go out and I'll sprint and I'll become winded instantaneously, and then I'll give up. Hey, running is horrible. So it's really that process of learning how to run and learning to work with your body and kind of push the boundaries in the right way, it sounds like.
Yeah, I guess in growing up, I didn't think too much about athletics and the different forms of training your body. And as I learned about it, I gained a tremendous respect for athletics and aerobic training, strength training. There's an incredible world there to learn, and how much you can learn about yourself. And there is a lot to learn in any, whether you want to swim or bike or run, strength train, flexibility. They all have an enormous depth, particularly nowadays. I think in the last 20 years, all these fields have grown enormously, and we've used a lot of science and a lot of experience as athletes have become faster, stronger, better, and it's really exciting.
In Springfield Medical Care Systems, we see about 100,000 visits per year from all different ranges, ages, and groups. Who could benefit from lifestyle medicine, you think?
Yeah, I think everybody could benefit from lifestyle medicine. I wouldn't have always thought that. As an ER doc, I wouldn't have known what it was. Now, having lived it and worked the last year in lifestyle medicine, I like to say to people, we all can get better in some aspect of our life. And because lifestyle is so encompassing, whether it's sleep or nutrition, exercise, stress management, eliminating toxins from your diet or your environment, I think we can all strive to get a little bit better in some element of your life and continue to do that throughout your life.
That's great. So much of the community, including myself, I'll go to the clinic, I'll go to the docs when I feel as though that I have some kind of ailment, maybe the flu. I've felt pretty bad for a while. You start to see people that are kind of aging throughout life, and they start to have developed chronic conditions and whatnot, and they go and they see the clinicians at that point, and they'll spend time with the NP, the PA, the MD, the DO, and all of a sudden get to a point where you're managing all of these chronic conditions. This lifestyle medicine almost sounds as though it could be something that could come before this. So almost a preventative piece of then having to deal later in life with maybe the loss of a lifestyle, if you will.
Yeah, I totally agree. It's a completely different perspective from when I was working in emergency medicine and how I looked at disease. We didn't spend very much time at all learning about nutrition and exercise and prevention of disease. And now, from my recent training and my past 10 years of experience in athletics and nutrition, I couldn't believe in that more, in terms of when we find someone who's starting to develop high blood pressure or high cholesterol or starting to develop diabetes, giving them the opportunity. I like to say they have the right to know how they can change their lives, not with medicines, but just with what they're eating, what they're doing for exercise, what they're doing for their stress management, for their sleep, all those different elements. I think it's incredibly exciting because most of our chronic diseases can be improved, prevented, or treated with lifestyle medicine. And that you don't need a prescription for it. You just need a little bit of help in helping yourself change some behaviors.
So this is new. As you said, 2004 is kind of really when this has started to really take off. And why haven't we heard about this yet? It sounds like it came from the West Coast, from a colleague of you that you've spoken with. You'd think that healthcare has been trying to keep people healthy for the longest time, but here we are talking about getting ahead of all of these things. How's this coming about, you feel like? How have we not heard about this more?
I don't have a good answer for that. I don't know why. When I look at it now, I'm shocked that this is what I wanted to do in medicine. Yeah. I wanted to help people help themselves. And honestly, there's some great quotes, and I'll get them mixed up a bit, but Hippocrates was a big proponent of food and nutrition and exercise and taking care of the human body. Thomas Edison said something about, the doctor of the future will teach people to use the human frame to treat themselves so that they wouldn't need medicines.
Yeah, we're starting to see more of insurance companies paying for preventative measures that way rather than paying for reactive medicine. We're starting to see accountable care organizations stepping forward and really focusing on reimbursement to healthcare systems based on specific outcomes for patients, which I think is important. So it dovetails nicely with what you're speaking of. We've talked about nutrition, lifestyle changes. people kind of get in their own lifestyle, right? They kind of get in that pattern, and you go to the grocery store, and you could probably follow the same person around every couple of weeks at the grocery store, and they're going to be hitting the same exact things. Those things are adjusted to our palate. We like the way that those taste. How can we change some of those things? It just seems those things taste great. A lot of those foods taste great that we like to eat. How can you incorporate some of this new behavior, new lifestyle, without it feeling like, I'm kind of stepping away from my comfort zone?
Very slowly is the short answer for that. And what's exciting for me is we're working with a lot of people right now. We're working with behavioral health, we're working with wellness coaches, we're working with nutritionists, and everyone's a little bit different, but it tends to come down to a lot of us when we're trying to change. Why are you trying to change? And if I'm working with someone, I would help them explore that. Why do you want to lose weight, or why do you want to get off these medicines? And it usually boils down to feeling better, living longer, being happier. And then we try to help people find their path forward. And usually that is picking a very small step. I like to say, the low-lying fruit, where we're going to not pick these really hard tasks. We're going to try and pick something small and easy to try and change. And that, you'd never know where that goes. I didn't know that getting across the swimming pool was going to lead to finishing an Ironman.
Yeah.
But when you start somewhere, it's really exciting what the next door that might open. So I've really loved this. So.
Yeah, just the idea of changing your life so much and then competing in Ironman, finishing an Ironman, that's pretty incredible. And the infectious energy that you have, it just kind of spreads throughout too. We've had Scott in many different clinics, and you can see this kind of come around from different patients, and it's this feeling of, I want to be part of this, I want to take on this change, and that's just been amazing. And it's your personality, it's other personalities that we have involved, but it's definitely a bit of a magnetism, I would say, to a lot of our patients. So much so that you see the eating habits in different clinics change on days that Scott's there. So, and every little bit helps, right? It doesn't have to be every day, but every little bit helps as you start to take some of these changes in behavior. Yeah.
Yeah, my passion right now is I love to see someone else get that spark, see that little change and see the difference that it can make, and help them keep pushing along to that next step, because it feels so empowering for them. I know that feeling. They're in charge of their life then, not beholden to a medication or a procedure or something like that. They're figuring out how to take care of themselves, and I think that's an incredibly powerful tool for everyone to learn, which is why I think everyone could benefit from lifestyle medicine. So.
And people are motivated by different things. You were motivated by your children. I can definitely sympathize with that in the same way. You want to be around for a long time with them, be able to do different things with them too, see your grandchildren and so forth, if you're lucky enough. And one of the pieces that people set those goals on, why do they want to change their life? Could it be that they're getting married, they want to look a specific way on the beaches, on the honeymoon? What could it be? What can we focus on? BMI seems to be something that comes up all the time. You can hear about it all the time. Weight management, BMI. Is this just a way to control BMI? Is BMI the benchmark?
No. Certainly weight is a very common thing that we think about. BMI, and a lot of the docs I work with will know that I tend to minimize BMI and weight. I certainly like to tell my patients that, yes, your weight will probably change as a side effect of what we're doing, but focusing on weight doesn't tend to be very helpful. I know if we start to make someone's diet cleaner, so to speak, so less processed foods, more plants, start to exercise more, start to have stress management, the weight will take care of itself. It is certainly an element, but we know, for example, your waist circumference is a lot bigger predictor of risk than your BMI. And BMI has some shortcomings. If you're too muscular, you may have a larger BMI and may give an inaccurate reading. So weight is I like to tell my patients on a piece of paper, if I had all this information about their health and their well-being, BMI would be this one little piece of information. It's helpful, but certainly not the be-all, end-all for your health and well-being.
That's great to hear. I mean, there's a lot of people that just focus on that one piece, thinking that is one sole indicator of health.
Yeah, I try to spend a lot of time helping people realize, and there was a study I just told some patients about this week, that we could have someone with a class 1 or class 2 obesity who exercises who would have less years of life lost than someone who's thin but doesn't exercise. So your weight is an element to your overall health, but it's certainly not the all-encompassing marker of health.
Okay, that's good to hear. So how would somebody get involved with this? I know you're doing some clinic time in Ludlow right now. You're doing some clinic time in Springfield, at Springfield Health Center. And it started with a dream of you coming to Springfield Medical Care Systems and talking about lifestyle medicine. I think that it's definitely grown around you. We've talked about a little bit of that patient feeling as though they're drawn to this type of service. So how can somebody get involved?
Yeah, we're developing that, and that's exciting for me too, because we're trying to draw in what I think are crucial elements: behavioral health, nutritionists, trainers, and physical therapy assistants and physical therapy. And so right now we're having the clinic days of a day in Ludlow on Tuesdays and a day in Springfield on Thursdays. We're also developing a group, so we'll hopefully soon have a group program where we'll take 8 to 10 folks through and work with an entire team of people to help them try and turn their nutrition and exercise in a positive pathway. So that's to be announced, I guess.
Something we're definitely working on it. Having the relationship with the Bmi recreation facility is something that's just really kind of moving in the right direction. You're starting to see a lot more people take accountability in their own lifestyle that way too. And it sounds like we're going to be working closely with them here in the future.
Yeah, I'm really excited about working with the Bmi. I think a gym facility like that is incredibly important in trying to keep a community healthy, because that's particularly where we live, where right now it's 20 degrees out and blowing wind and icy, and but they could go for a swim, or they could go for a run or a bike, or take a yoga class, or learn how to strength train. That combined with the trainers there, and I know they just brought on a new wellness coach as well, who's also going to be working with us. So I hope that relationship continues to grow, because I think if we could get it to become more part of the medical system, that could be incredibly powerful for our entire community, to be able to have docs understand, well, someone's just developing high cholesterol and they're interested in trying to learn how to run. Well, maybe that's their medicine rather than the statin. Or same thing with blood pressure, or a lot of these things.
Running has a lot less side effects probably than some of these statins and other medicines.
I could guess running is, it can be rough on your body, so you'd want to progress slowly, because there's a lot of joints and, particularly if you're overweight at all, knees and hips and things like that. But walking uphill to start, that progression, when I learned to run, I certainly went through every injury in the book. So I am sensitive to that, and when people say they would like to run, and I would love to help people run, but would be cautious with it, just because I've also been through a lot of the injuries. Biking's a lot less impact, swimming's a lot less impact. There's a lot of great forms of exercise, and I like to tell people there's not one exercise that's the perfect exercise. It's the one that you like, that you'll do consistently, that's the best for you.
I think that's a key. If you have somebody that just really dislikes running, pushing somebody to run all the time is just not going to necessarily work. Yeah.
No, whenever we're trying to help someone change, I would never push someone into something or ask them to stop eating something or start eating something that they really just aren't interested in. Another big difference between the way I was taught medicine and the way I practice medicine now is it's much more of a collaboration, where I like to tell people I'm more of a coach. They're in charge. I will try to give them the best information I can to help them make choices, but I'm not going to tell them that they have to do this or have to do that. I'm going to help them make good decisions for themselves.
Absolutely. Well, that makes good sense. For cost, as far as people coming around, they see their outpatient clinician, a primary care clinician. There's costs associated with those visits, co-pays, deductibles, those kind of things. Similar for seeing you in lifestyle medicine?
Yeah, this is also an evolving part of lifestyle medicine, but Springfield Medical Care Systems has done a great job of working with our major carriers, Medicare, Medicaid, Blue Cross Blue Shield, MVP, to help. These services are covered at this point. There's certainly plenty of research to back up the amount of savings a patient in terms of yearly cost to a patient for medical care. Some particularly Medicare. Studies have shown 2/3 the cost to 1/2 the cost for women when you have an active, healthy lifestyle. But I would quickly point out, I'm not sure we can put a cost on if you prevent a cancer or prevent a heart attack or a stroke or diabetes. I don't know how you put a price on that, and certainly learning the way to live a healthier lifestyle and avoiding a lifetime of medication, I'm not sure how you put a cost on that too. So to me, the cost savings, this is a common thing said in lifestyle medicine. It is one form of medicine that actually is very cost effective. It actually costs less to prevent diseases with this than with medication. So
yeah, when you frame it that way, that's mind-blowing, because you're right about that. All the time lost, if you end up having a heart attack, you have an MI, you can't spend time with your family, or you can't exercise the way you did, go for a walk even, so how do you put a price on that?
Yeah, I was at a conference at Harvard, and being around medicine for the last 20 years, my mind was blown when one of the lecturers said, we think that we can prevent up to 70% or maybe even 80% of cancers.
Wow.
And to me, that sounded like the cure for cancer.
Yeah.
When 7 out of 10 of them could be prevented. And when we realize how many of these come from lifestyle choices, I was really excited by that.
Wow. Well, that's amazing. Well, this is it's something we've been definitely excited about after you came on board, and we had a couple discussions. I even changed my own personal lifestyles, and about 34 pounds lighter than when I first started. And there's those things where if I like to eat something specific and you just change your palate a little bit, and maybe the first time it didn't taste all that great with maybe eating black beans, but it just started to be like you're craving that piece, and your body it feels like fuel for your body, and you get a lot more energy. I think their moods improve.
Yes.
And you're able to hit the gym and really kind of do what you need to do and keep building from there. So just that little discussions that we've had, it's totally altered my own lifestyle. So it's not something, and I wasn't a big trainer, I wasn't somebody that was ready for this, it's just something that you can easily start to make part of your day, and it doesn't feel like you're losing anything.
Yeah, I love to hear that. That's exactly what I would love to help people do. It does feel like small changes. There's some great research, and it would have been hard for me to hear or believe before I went through it too, that your palate can change in as little as 7 to 14 days. You start eating some other foods that at first may taste not so great, and after about 2 weeks they may taste great to you.
Taste great, absolutely.
And it's a lot easier to accept that when, just like you said, you start to feel better. You start to have more energy, you start to be happier, you start to be able to work out more. That makes it a lot easier to try these foods. And then on top of, and what I like to remind people of, well, usually if they're seeing me, we're trying to treat a disease with that. So if you're feeling better, it's tasting good to you, and you're helping get rid of your high blood pressure or prevent a heart attack or cancer or diabetes, cholesterol, well, that sounds incredibly worth it to me.
Yeah, absolutely. And the team that Scott leads too, as far as even having effect with the community health team, which does a lot of outreach for a lot of patients, dietitian, nutritionists, helping people understand how to shop, finding organic foods that are not processed, that are affordable. I mean, this is all a big piece of what we can do with helping a lot of patients.
Yeah, the community health team has some wonderful programs, and they're free. To help you quit smoking, to, like you said, I think a huge part of people learning to live healthier lives can start right at the grocery store. I've certainly continued to try and learn how to shop, how to read labels, how to pick healthier foods, how to avoid overly processed foods. The community health team has dietitians, nutritionists. They've got people to help you with movement. There's a Move to Improve program. There's a Tai Chi program. All for free. I think there's some wonderful opportunities happening. It's really exciting for me.
Yeah, Maureen Shattuck, who's somebody, she's one of our nurses as well as our certified diabetic educators. And one day we were talking, it was a couple years ago, so when Mo watches this, she'll be like, oh yeah, I remember saying that to Josh. And it's staying on that outer loop of your grocery store.
Yeah.
And I never really had thought of that. as far as, oh yeah, this is, you got your meats, you got your vegetables, your fruits. It's totally the outer ring of the grocery store. And so now it's kind of a challenge. What can I get through at the grocery store without having to duck down a center aisle and pick up something in there that's processed?
Yeah, that I totally agree with you. It's usually the real foods are on the outer ring, except for dried beans or beans, which tend to be down the aisles.
True.
Other than that, I can't think of too many things. Some spices and things that are in those aisles. But usually if you're going into those middle aisles, there could be some landmines. So
some trouble spots. Absolutely. Well, Scott, thanks so much for joining us today. I really appreciate your time.
It was my pleasure.
This has been a real good time. I think this will help a lot of our patients out there kind of get some ideas of not only lifestyle medicine, but where Springfield Medical Care Systems is headed and keeping you healthier and out of the actual health center. So making those life changes now will keep you healthier in the long run.
Thanks, Josh.
Thanks a lot. Appreciate your time.
Good to see you.
Good to see you.